Hello, this is Reeya coming to you from our APES Central office in Latin America, where we talk about diseases, and more diseases. Today we have a new fascinating report about struggling students in Plano, Texas. However, something's distracting me right now. I'm feeling kind of itchy. Wait, are those mosquitoes I see? Before we get to that story, let's examine what exactly is going on because of all of these mosquitoes flying around me. Let's see why there's so many in Brazil. Hello, Dr. Suchir?
Hello?
Hello, Dr. Suchir. We are live on Ape Central and we are calling to find out why are all of these mosquitoes flying about in Latin America?
I bet. Currently, developed and developing regions alike are dealing with Zika, an emerging virus, but it's been most heavily concentrated here in Latin America.
Zika? I've never heard of that one. What is it?
It's a painful virus that's primarily transmitted by Aedes mosquito bites, sex, and from mother to fetus during pregnancy, while affecting 87 countries with an estimated 31,587 cases total in 2018. Actually, can you give me a minute? I have a patient who's contracted a case of the Zika virus.
Oh my god, who's the patient?
Oh god, my head is killing me. Well, I'm Roy, and I came to Doc Suchir after a week of awful rashes, headaches, and joint pains that I just couldn't take anymore.
Everything that Roy is complaining about are clear symptoms of Zika, and we might need to get him some of his family members to be with him during this.
Let's connect Roy's poor mother to her sick son.
Hello?
Hi, ma'am. You are on live television, and this is Chief Anchor Reeya speaking. We're so sorry to tell you that there's been some tragic news.
What's going on? Is my son, Roy, gonna be alright?
Ma'am, he's been diagnosed with the Zika virus.
Oh no, what's gonna happen to him?
Roy is actually quite fortunate in this case. For non-pregnant adult males, these symptoms that Roy described usually only last 2 weeks, and after the Zika virus will remain for a maximum of 3 months. However, for pregnant women and children, the risk increases exponentially. Pregnant women that have Zika may have babies born with a smaller head size, known as microcephaly, leading to a reduction in cognitive ability and complications during childbirth. Since children have a relatively undeveloped immune system, they are also more likely to develop neurological complications from Zika, which can eventually turn into nerve damage.
Well, I guess that's good to know. But what precautionary measures should my pregnant family members and friends who may be traveling to Latin America take?
First and foremost, it's always important to heed all travel advisor warnings from health organizations about Zika and make an educated decision to travel, especially if you're pregnant. However, there are a number of preventative measures they can take to reduce the risk of infection. They should first immediately remove all sources of standing water from their lodging, since that's where Aedes mosquitoes breed, but also consistently wear bug spray and long sleeves. In addition, all of them should participate in protected sex.
I guess those measures are smart, but what about total immunity, like vaccines or treatment post-infection?
Unfortunately, as of now, no antiviral treatment has been developed to deal with the virus, and no vaccines have been approved for clinical use. However, medications like Tylenol help relieve the symptoms, and vaccine contenders like CPIV, which uses an inactive virus, and RZIKV, which uses a live virus, are in phase 1 and phase 3 of their clinical trials respectively.
Thank you all so much for tuning in to Ape Central for this segment on the Zika virus. Make sure to tune in for future episodes only on Fridays at 12 p.m. and use the Offspray #sponsored.